9:30 tonight. Imagine being so distracted you can't keep a relationship. Forgetful enough, you've replaced your cell phone 3 times just to lose it again.
Or imagine not being able to finish the dishes because now you're caught up in that load of laundry. Well, these are all symptoms of ADHD. It's a disorder we usually associate with school children, but Fox 25's Jordan Lucero reports that disorder has lifelong effects.
For Chad McCoy, even sitting down with us for this interview was a challenge. He went back and forth with us through email before settling on a time and day.
I cannot make a decision to save my life.
McCoy second guesses everything. He has ADHD, or attention deficit hyperactivity disorder. He was diagnosed when he was 30.
I see a challenge. I see it coming. I feel it. I know it. And, you know, there are moments where my mind just scatters and, whoa, wait a minute, what direction do I go? What do I do now? What direction do I need to head? But
McCoy is not alone. Researchers say 1 in 25 adults is going through the same thing. The disorder is lifelong. Dr. Gail Hobson says adults with ADHD have always had the disorder, but they may not have been diagnosed until later in life.
The problem is that the symptoms are fairly broad, so you can see many people who think they have those issues, but it's not really truly that.
Dr. Hobson says people with ADHD may be easily distracted or impulsive.
They tend to have trouble with relationships as adults because they can't stay focused and attentive to one relationship.
Other symptoms are extreme procrastination, poor time management skills, forgetfulness, and trouble focusing.
I find myself just doing one thing when I'm supposed to be doing something else. And pop, 2.
Jordan Eason didn't realize he had ADHD until he was an adult, and a coworker at his dance studio noticed he couldn't pay attention. Now Eason says he can see how the disorder affected him since childhood.
Looking back, like, okay, maybe that's why I wasn't, always the best kid in school.
Evan Decker's diagnosis was made early, at age 7, but he still deals with the disorder today.
I still had the lack of focus. I still had, going a million miles per hour. Sometimes I talk too fast where people can't hear me.
I am very high on the overfocus aspect of ADHD. I'll get locked in on one thing and continually beat it to death.
Decker and McCoy are using medications to help them through the disorder. Eason is not. Dr. Hobson prefers a therapy approach when she sits down with patients to find practical tools for dealing with ADHD, like utilizing day planners or teaching patients to slow down and take a breath before making decisions. She says there is no one approach for dealing with ADHD and says patients just need knowledge.
How can I understand and use these symptoms to make better choices?
That I can continue to live with it and have people around me understand.
Jordan Lucero, Fox 25 News.
Sound familiar? Well, Dr. Hobson says if you think that you have ADHD, do some reading and learn more about the disorder and talk with friends and family to see if they have noticed the symptoms in you. After that, make an appointment with a psychologist or a therapist so they can make a diagnosis.